Hello. So for this article, we're supposed to reflection thing. We're supposed to read about rehabilitation, maintenance, and relapse prevention strategies for substance uses. So while I was looking for an article for these, I actually found an article about COVID-19 and substance use disorders. Now, I had watched a video about this through YouTube in the past, and I had found, and it was interesting, the day I go to actually read the article, because it's due by 11:55. This thing came in the mail that said caring for Mainers who use drugs during COVID-19. Throughout the U.S., there has been troubling reports of increasing overdoses during the COVID-19 crisis. If you use drugs or know someone who does, resources are available. There are changes to rules and systems to help connected people with the services they need during this time. The community is here and ready with support and resources. And then on the back, they talk about syringe service programs. Maine has a high rate of hepatitis C. Providing sterile syringes and other supplies can help reduce the risk of hepatitis C. But sterile works may be harder to find during this crisis. The Health Equity Alliance's syringe exchange program remains open and offering food, sterile needles, Narcan, and other supplies. They also offer case management and telephone support for people who just need someone to talk to. Then it says, can't make it to the exchange, need delivery services? Well, needles and other supplies can also be sent in the mail and provided by home delivery services. There are 3 organizations that offer this: the Home Health Equity Alliance, Maine Access Points, and Needle Point Sanctuary. And then they have a list for free Narcan, Northern Light Pharmacy, Northern Light Pharmacy Riverside, Northern Light Pharmacy Westgate, Heal, and Maine Access Points all provide free Nexalon or Narcan. And there's no catch to that at all. Treatment services, treatment providers including, you can call 211 Maine. And then recovery services, and here we have the Bangor Area Recovery Network, which holds virtual in-person meeting for anyone anyone in or seeking recovery, as well as meetings for affected others. I know it's called the Bangor Area Recovery Network, but it's always interested me that it's Bangor area, but it's in Brewer, because it's not just for Bangor, it's for Bangor area. I just found it interesting that the day I go to do this about COVID-19 and substances, it's the same day I get this little pamphlet in the mail trying to help those who have substances and live in Maine. I might actually include that in my reflection that I do for her, because it's interesting that just coalesced that way. So I'm going to grab something hard to read off of and highlight from. Maybe turn down my music a little. There. So now I can get back to, my article. So this paper was put out by Neuroscience, Recovery and Substance Use Disorders, Recommendations to a Comprehensive Healthcare Response, an International Society of Addiction Medicine, Practice and Policy Interest Group Position paper. This actually was done in the Integrated Substance Abuse Programs, University of California in Los Angeles. I was trying to see if I could find where it was done. The journal it was published in was Basic and Clinical Neuroscience. So it's the beginning of that. This article is quite long, 19 pages, I believe, was fully when I was done, but that's including the resources. Once again, this is more just to help me learn about it so I can write about it for classes. So we start off with the abstract. as we all know, COVID-19, or the coronavirus disease 2019, has changed everything. We were in lockdown for a while. Things are not going to be back to normal anytime soon. We still have to wear masks everywhere. My daughter was actually did a little video on my phone. It's kind of cute, where she was telling people to stay inside because of the coronavirus is dangerous. Explaining that to her has been kind of interesting. She doesn't remember half the time what's going on, so I have to remind her, nothing's open, remember? And then she'll go, oh, right. But anyway, so the coronavirus disease 2019 is escalating all over the world and has higher morbidities and mortalities in certain vulnerable populations. People who use drugs are marginalized and stigmatized group with weaker immune responses, vulnerability to stress, poor health conditions, high-risk behaviors, and lower access to healthcare services. These conditions put them at higher risk for COVID-19 infection and its complications. So, in this paper, an international group of experts on addiction medicine, infectious diseases, and disaster psychology explore the possible raised concerns in this issue and provide recommendations to manage comorbidity with COVID-19 and substance use disorder. So it's actually kind of interesting in that aspect. So, it does deal a lot with what I mentioned, recovery, relapse, and treatment. So, the highlights in this. Healthcare providers in treatment and harm reduction settings must always have PPE. Screenings of PWUD with COVID-19 is a priority with respect to human rights. Creative, evidence-based, and realistic approaches are needed for the current situation. Virtual contacts and mobile-based platforms could facilitate mainstream interventions. Different clinical manifestations and drug interactions are a major issue in PWUD and COVID-19. PWUD is people who use drugs. Whew. So they have a plain language summary here on what they put through the highlights. So in plain language, the new coronavirus created a complex situation for all sections of the communities around the world. Healthcare providers are in the front line of intervening to stop the spread of COVID-19. Meantime, people who use drugs are at increased risk during this pandemic since they are stigmatized and marginalized populations. Health service providers who are providing different needs for these people in treatment in harm reduction settings should always keep themselves safe with using standard PPE based on the World Health Organization recommendations, or WHO. Additionally, people who use drugs live in crowded locations, and so screening and early identification of COVID-19 patients are important to break the cycle of transmission. It is recommended that protocols for opioid substitution therapy modify with complete adherence to patient safety regarding both opioid drug risks and COVID-19 infections. It is important to have in mind that different stages of OST need different approaches. People who use drugs are more vulnerable to stress and other mental health problems. This makes psychological interventions such as cognitive behavioral theory and other modalities very important to have during these difficult times. Should have gotten something a little bigger to highlight off of here. To assist in sustained treatment. Medical conditions such as respiratory illness, renal insufficiency, chronic pain, and cardiovascular disorder are also important medical conditions that should be addressed appropriately among people who use drugs with COVID-19. Health service providers in both fields of addiction treatment and COVID-19 treatment and prevention systems should be aware regarding special situations arising in the overlap of drug use and COVID-19 illness. So now we finally get to the introduction. Coronavirus disease 2019 is a member of the coronavirus family that infected humans. It first emerged in the Wuhan region of China in November 2019. By March 2020, the World Health Organization assessed the global situation of COVID-19 as a pandemic. Patients with cardiovascular disease, chronic respiratory disease, people aged 60 or older, and males have a higher risk of mortality than the rest of the population. Frequently reported clinical symptoms at the onset of the disease include pyrexia, cough, fatigue, and shortness of breath. Sore throat, and less commonly, sputum production, headache, hematosis, and diarrhea have also been reported. In more severe cases, COVID-19 can cause pneumonia, severe and acute respiratory syndrome, and sometimes death. Currently, the medications used for severe cases of COVID-19 include chloroquine phosphate. This article also, I don't know what month it was done, so it might be different now, April. So this was done before we opened, everything back up. We were still kind of in a lockdown situation. Hydrochloroquine sulfate, also, I can't read those, but none have been approved by regulatory authorities to use against COVID-19. The most common strategies, as advised by WHO, include preventive measures such as quarantine and limitations of movement in affected areas, interruption of human-to-human transmission, early identification and isolation, providing appropriate care for patients, identifying and reducing transmission from the animal source, and minimizing the social and economic impact through I'll just grab a couple pages. There we go. Through multi-spectral partnerships. Bai and colleagues mentioned some COVID-19 transmissions from asymptomatic patients as a challenge for preventive activities. In most countries, people who use drugs are stigmatized and marginalized population with lower access to health care. They suffer from poor health, weaker immune functions, chronic infections, various issues with respiratory, cardiovascular, and metabolic symptoms, as well as a range of psychiatric comorbidities. PWUD are a marginalized group who experience high rates of morbidities 3 to 5 times higher than the general population. Ching et al. Estimated that the risk of death among people who use drugs, homeless women, in Toronto is 5 to 30 times higher than the host counterparts. That doesn't surprise me, but 5 to 30, that's a big range in there. Substance use imposes different health problems, which may complicate superimposed infection with COVID-19. For instance, chronic high alcohol consumption significantly increases the risk of acute respiratory distress syndrome. In 2009, during the 2009 H1N1 epidemic, a history of opium inhalation had been identified as a risk factor for admission to extensive care unit with confirmed H1N1. Additionally, it is essential to understand how people who use drugs differently perceive danger and risk-taking behaviors during an epidemic, making them more risk-averse. PWUD have higher rates of smoking, and different studies estimate the current smoking rate of more than 70% among them. Several studies found smoking a significant risk factor for Middle East respiratory syndrome, transmission. A literature review did not reveal even one article focusing on substance use disorder and COVID-19. This was a literature review paper about the topic. I didn't find much for that. I found Bangor Daily newspaper where I live had an article and a video. There was another video I found, and now they're putting out this. So the problem is becoming more and more aware. As I said, this was written in April. It's almost August now, so we've had time to really consider these things. Therefore, a group of international experts on addiction medicine, infectious disease, and disaster management teamed up to explore the comorbidity of COVID-19 infection with substance use disorder and identify the necessary recommendations for health service providers and policymakers. So, that's that. So then they break it down. So they have about the system, the population as a whole, the people who use drugs care provider, protocol for opioid psychotherapy provision, consideration regarding different stages of maintenance therapy, psychological consequences, psychological interventions, the specific pathology issues during treatment of COVID-19 infections. And then there's some ethical considerations, and then that's the end of it. I'm not going to go through all of those right now with you guys because of the fact that this video is already 17 minutes long. But I'm going to talk about it in my paper, of course. And anyway, so that is all I'm going to do for now for this. Thanks for watching.